Welcome to Medical Minutes here on Time Warner Cable DMG TV2. Today we go on location to the Altman Bloodmobile in New Philadelphia, and we'll talk with Union Hospital's Carrie Gardner about donating blood. Then Dr. John Scott, a dentist from North Canton, goes over everything we need to know about dentures. And we'll wrap up the show with Dr. Nathan Samsa. He talks about those nagging lung diseases called chronic obstructive pulmonary disease, all coming up on Medical Minutes.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Are you suffering from asthma or emphysema? Do you have shortness of breath or a nagging cough you just can't shake? Hi, this is Dr. Nathan Samsa. I'm originally from Strasburg, and I've returned after my medical training to serve the Tuscarawas Valley. I'm board certified in pulmonary medicine, and I'm ready to treat your breathing and lung problems. My office is located at Union Internal Medicine Specialties, 515 Union Avenue, Suite 187 in Dover, Ohio. Call me at 330-343-4411 for a timely consultation.
Welcome to Medical Minutes here on Time Warner Cable DMG TV2. With me today is the Community Relations Director from Union Hospital, Carrie Gardner, and we're obviously outside the Altman blood donation bus in downtown New Philadelphia today. Carrie, tell me a little bit about blood donation. How often do you have to do it, and why do you need people to donate blood?
You know, the blood that patients at Union Hospital depend on and use in really all their blood needs, our goal is to supply those blood needs from local donations that are given at mobiles like we have here today. Of course, we have the blood donor room at Union Hospital, which is open Tuesday through Friday. No appointment needed, just come on in and donate blood. We have Union Hospital has partnered with Altman Hospital in the blood program for many, many years now, and so really does meet the goal of supplying the blood that our patients need and rely on. So that's why it's so important to support when you see the big blue bus here from the Altman Union blood program, donate blood, come to the hospital to donate blood, because that's where the blood our patients rely on comes from.
Do you know how many pints of blood are donated, where you have to go out in the community and go collect it?
Well, safe to say there's thousands of units of blood donated locally every year by, I don't know how many individual blood donors there are. Some people donate blood 5 or 6 times a year. Some people it's once a year, and everywhere in between there. But we really rely on those blood donations to meet our patients' needs, and so that's why it's so important. When you see the bus out here like it is in front of the New Philadelphia Fire Department here today, to take, it only takes, what did it take, Keith, about 15 minutes to donate blood today. So it's easy, it's quick, and I think he would testify relatively painless. And
in January, blood donations tend to drop off. At Christmas time, or maybe even in the summertime, people are more likely to, hey, I have time, it's a great day, I'm going to go donate blood. But right after the holidays seems to drop off.
Yeah, this is we're moving into a tough time of year, and January is a blood donation month. And in fact, the Altman Union blood program is going to kind of sweeten the pot a little bit. If you'll come in and donate blood, and I had to write it down so I don't forget it here, you'll receive a $5 certificate for McDonald's or Subway. So a nice little reward for doing a great thing and donating blood during January.
Right, and we did watch Keith donate some blood. And what's involved in that process, as far as you just lay down and they put a needle in you and you're done?
Well, it isn't very complex. There's an interview, a bunch of questions to ask. They want to ensure the absolute safety of the blood supply. So we really want to know all about the donors and where your blood has been in recent times. And of course, you want to be healthy, and certain medications might disqualify. So there's a long list of questions you'll be asked. And after that, then it's lay down on the couch, and in about 15 minutes later, you're up. You have some juice, something to eat, and you're on your way.
And why is that? Why do you need a little juice or something to eat right after you donate blood?
Well, I'm not a medical person, but they tell me that they're just taking a unit of blood out of your arm, and so you need to replenish your vital bodily fluids, as they say, and just have a little snack, because they want to make sure that when you leave the bloodmobile or you walk out of the donor room, you're feeling well, don't have any dizziness or faintness. It's just a precaution, common sense precaution.
And at Union Hospital, do you get all your blood from the same blood bank?
Our blood primarily comes from the Altman Union Blood program, and actually when blood donations are made here locally, they're tagged as such, and when Union gets the blood coming back then from the blood center in Canton here for our use, it's blood as much as can be logistically and reasonably provided from our local donors here.
And how do you get people to come out to these blood donations, especially the mobile one?
We have hundreds and hundreds of very loyal, long-time blood donors, and they're regular as clockwork, and they are the heart and soul of the blood program. But we're always the bloodmobile goes out to the local high schools. They're out recruiting new blood donors all the time, and new blood donors are always welcome. But boy, I tell you, most of the blood comes from the regulars that have been doing it for many years. You get people that get the certificates for 6, 8, 10 gallons of blood over time.
That's a lot of blood. You mentioned going out to the high schools. How young can you be to get started?
I think the age of 16. You can start after age 16, and so they do. They're very successful. The blood drives at the high schools are very successful.
And where else do you go besides schools? I mean, businesses, do they also sponsor those?
Oh yeah, the bloodmobiles go out to churches, to civic centers, to fire stations like we are here today. Really anywhere and everywhere. And you can actually, community organizations can use a blood drive as a fundraiser. There's Little League baseball teams, soccer teams, softball teams that set up to go through the blood center. They recruit their donors, the bloodmobile comes out, and they can make $400, $500, $600 for their team by having a blood drive.
Oh, well, there's always a good idea to not only replenish the supply, but help out your organization. Right. Like I said, January is the special month that they want you to come out and donate blood. Now, you've had blood shortages in the past where you came out to the media and said, hey, please let everybody know we need some more blood.
Yeah, from time to time you get a certain type shortage, or if you have terrible winter storm and the roads are bad and it cuts down on the people getting out to donate blood. It has a limited shelf life, so every once in a while, and it doesn't happen very often, but every once in a while you do have to put the word out that we need a certain type, and the public always responds.
All right, and you don't even need to know your blood type, they'll figure it out, right?
That's right. They'll do the little finger stick first of all to type your blood and get your they do an iron check and make sure they'll check your blood pressure. And again, it's all safety precautions, and just want to make sure that the person donating blood is healthy and is in a good physical condition to be able to donate blood and do it safely.
I will certainly appreciate everybody donating blood, especially in January.
Absolutely.
Our guest on this segment, Kerry Gardner, thank you so much for being here. He is the Community Relations Director for Union Hospital. We'll have more medical minutes coming up.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
We live in a fast-paced world. Say goodbye to searching books and search engines for all the answers. Now there's iTowns. From finding a place to dine or locating your family doctor, you can also check out the high school game of the week from TV2 Sports. Get your answer with just one click. iTowns has it all.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. And we're back in the studio, and this segment we have Dr. John Scott. He is a doctor of medical dentistry in North Canton, and we're going to talk about dentures today. If you don't have any teeth, you need something to chew with. Isn't that what dentures are for?
That is absolutely correct. You know, I always compare it to prosthetic legs. For somebody that is unfortunate enough to have to lose a leg, you get a prosthesis. The same applies to the oral cavity. And all the same training steps and everything associated with prosthesis applies to the mouth just as much as it would to any other part of your body.
So if you have dentures, you have to learn how to eat again?
Exactly. With the leg, you have to learn to you know, crawl before you walk and walk before you run, and the same applies to dentures. It's a whole learning curve from biting in smaller bites so you do not choke, learning to talk, learning to speak all over again. You know, there's certain sounds that are very difficult to say that our teeth actually help us make, like the S's, the F's, and the V's. Very challenging for people who get new dentures. But in time, they overcome those, and the goal for anybody who has to have dentures is to have a natural set of looking teeth that anybody who does not know them would never know they are prosthetics or dentures, as we call them in dentistry.
And why do we need dentures? Why you have to have all of your teeth missing like these models are?
Well, today we're talking specifically about dentures. There are other options for people who are missing, you know, teeth here and there, so to say, with removable partial dentures that actually clasp onto teeth. But if no teeth due to disease in the oral cavity are to be had in the oral cavity, then dentures are your pretty much only choice for full prostheses in the mouth.
And is it only the elderly that need dentures?
Unfortunately, it's people of all ages do need dentures. A lot of it depends on the oral hygiene that has been obtained throughout their entire life. In the older generations, dentistry was not as prevalent as it is today. And unfortunately, you know, the disease due to the disease in the oral cavity from periodontal disease or excessive cavities or caries has resulted in we have to extract the teeth and fabricate dentures.
And show me what you have here. Like, what are these?
These are upper and lower dentures. This is an upper denture, okay? This is the ridge. This is what the mouth looks like with
no teeth?
With no teeth. An upper denture is very, very easy for most people to wear because an upper denture is held in by suction, okay?
You don't have to put gooey glue stuff
Some
on
people do put a little bit of glue, but for the majority of the population, upper dentures are relatively easy to get used to. The problem arises when we get to the lower denture. A lower denture,
because your jaw's always moving.
your jaw's always moving, you got it. You have a ridge down here. And what people tend to forget is you have a lower jaw moves. The upper jaw is stationary. So when you have a lower jaw moving, you have a tongue in your mouth, you have food chewing up and down, a lower denture tends to flip-flop up and down. And as a result, people rely on a lot of paste to hold the denture into place.
Ew, I don't think that sounds good.
It's not good, but it's better than the alternative of having no teeth. Now, with modern dentistry, we've come up with this, what is called dental implants. That's where an oral surgeon can go in and place 2 implants.
They look like screws, just right
That's
in your
exactly
lower
what
jaw.
they are. They are titanium screws that go right down into the jawbone in the position of what would be your canine teeth. The lower denture can then click on there and it does not move. It does not move with food.
You don't get food in between? I think
No.
that would be painful.
No, it sticks completely down. People that have had this done have literally come back to the office in tears and saying, why didn't we do this 20 years ago? The drawback is they are very expensive. But in my opinion, a lower denture should not be made in today's age without the lower implants.
And will insurance cover that?
Most of the time, insurances will not cover implants. There are some that do cover implants, but I'm finding out for the most part, this is an out-of-pocket of expense for the patient.
So when you get all of this dental work done, you need to take care of it, probably more so than your natural teeth, right? What do you have to do?
You take care of dentures exactly like you do normal teeth.
You leave them in your mouth when you're brushing?
You leave them in your mouth when you
don't
brush
put
them.
them in a cup on the side of the bed and let them soak all night, or?
All dentures should come out of the mouth every night. The simple reason is bacterial growth. The mouth is a warm, moist place and likes to attract bacteria. And if you have something rubbing against the tissues of the mouth, then bacteria will grow. So we recommend taking the dentures out every night, soaking them in any type of solution. I just happened to bring a sample of Fixodent with me. They make a good cleaner as well. There's several on the market. They all relatively do the same thing. This is a denture brush. It's a little bit bigger than a toothbrush, but it's meant to get in there and really scour the insides of the dentures, okay? You can brush your teeth with a normal toothbrush in your mouth to make you feel like you have fresh breath and fresh teeth. But as in anything in life, you take care of what you get yourself. And a good set of dentures should last a patient 10 to 15 years. Teeth can always be replaced on a denture. If you break a tooth, the dental lab can just put on a new tooth. So there are several options to repair dentures if they break, but the number one rule, and I know you will get a laugh out of this, keep your dentures away from your pets.
Oh my gosh, if your dog got a hold of your homework, well, they'll get a hold of your dentures.
There is something in the human saliva that attracts a dog's nose. And at least 4 to 5 times a year, I have patients come in that say, "You're never going to believe this. My dog ate my dentures." The same applies to partials. The saliva, the odor from our saliva, even though we can't smell it, embeds into the acrylic, and animals just love them. So keep them on a high shelf, out of reach from your pets. Take good care of your dentures, and they will take good care of you.
Great advice. Dr. John Scott, he is a doctor of medical dentistry in North Canton. Thank you for being on Medical Minutes.
Thank you for having me again.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome back to Medical Minutes here on Time Warner Cable, DMG TV2. On this segment, we have Dr. Nathan Samsa. He is located at the Union Internal Medicine Specialties right here in Dover. Nathan, thanks for coming on the show.
Thanks for asking me here.
And you are a pulmonologist.
Correct.
So that means you're a lung specialist, right?
Yes.
And during the winter months, everybody gets a cough or a cold, but sometimes it's chronic, meaning that it's ongoing. When you have chronic obstructive pulmonary disease, or COPD, that's pretty serious, isn't it?
It can be.
What are some of the different diseases that are considered COPD?
Well, when we talk about COPD, traditionally that has to do with the public 2 diseases, chronic bronchitis and emphysema. Years ago, we used to think that those were 2 separate diseases. Chronic bronchitis was you're coughing daily, you're coughing up some yellow mucus. And emphysema was traditionally what we called a pink puffer. They're the really emaciated individuals, they're skinny, they can't eat, they can't talk without being short of breath. But now we've discovered that it's kind of a continuum, that you can have both this chronic bronchitis and emphysema, and it's just one large disease state that has different presentations.
And when I think of chronic bronchitis, I think of more of, cold symptoms that have escalated versus emphysema. It's just a kind of a side effect of smoking.
Right. The majority of both are side effects of smoking. Now, you can have what we say acute or a sudden onset bronchitis, and that's traditionally when you get like a head cold that kind of settles in your chest, and it just lingers for a couple days or a couple weeks and goes away. Chronic bronchitis is chronic, which means ongoing. So we're talking months. These people have months. Now, they can have a flare-up, so they can say acute on chronic is our terminology.
Oh, great, so it's both.
Yeah, so we have all these weird terms that we speak about, but they can have a flare-up of this, and these are the type of people that they start having symptoms. They notice a different change in their sputum. It's not yellow anymore, it's green, or they may have a little bit of blood in there. Those are the people that really need to be looked at in their doctor's office or go to the emergency room to get checked out.
And can you know before that happens when you should go see a doctor?
I always say people are the best judge of their own health. They know their bodies more than I ever will. So if they notice that they're more short of breath doing their activities of daily living, like doing dishes, taking a shower, if they notice, like once again, the change in their sputum, they're coughing a lot more, or they're just thicker, or they're just short of breath. If they're on oxygen, they notice that they have to turn up their oxygen more just to meet their own activities, then that's when you need to go see somebody.
And is oxygen the only way to treat it? Do you have to carry around your little own bottle of oxygen?
No, oxygen is usually for what we say end stage, that there's so much destruction from the emphysema or the COPD that the body needs the oxygen. Now, there's an apprehension with people that they don't want to go on oxygen. Number one, it's, they're tied down to it. They think it's a loss of their independence, and they're say, well,
there's portable oxygen.
Yeah, there's portable.
Wheels.
Yeah,
I've seen them.
But still, they're tied to that, and I don't want to carry that around. They're going to make fun of me.
Or you have to wear.
Yeah, the what we say a nasal cannula. The other thing is people say that they're going to get addicted to oxygen, but you're not addicted to it. Your body needs it.
Right.
But
we need to breathe.
Right. But as to your original question, other treatments, there are many treatments. Usually we start out with inhalers. There's only 2 proven benefits to actually stop the progression of COPD. Once you have it, you have it. But to stop it, number 1 is to stop smoking if you're smoking. That is proven to stop the progression. The second thing is if you need oxygen. Now, there's certain tests where you have you walk around to see if you need it. There are certain exercise programs called pulmonary rehabilitation that we can enroll you in if you meet certain criteria. And that is actually shown to help people have more lung function. I've seen
sort of a workout for your
exactly.
lungs.
It's like cardiac rehab after you have a heart attack. It's for your lungs. I once saw some person running 23 minutes at full pace with oxygen on a treadmill, and he was upset he did not meet his personal best run. And I'm like, I couldn't even do that.
Without oxygen,
Right.
yeah.
But inhalers are pretty much the mainstay. They will help increase your ability to breathe, but doesn't hold off the disease.
And I'm thinking inhalers just kind of a single puff, or is it something that, what do you do with that?
It's more complicated. Now, each company, to set themselves apart from the other companies, they all have to have their different devices. The usually one you see is a puffer where you kind of go like that. That's one we always think about. Newer ones is one's called Spiriva, where you actually have to put the capsule inside the device, crush it, and then breathe it in. That's difficult for people, especially elderly who have arthritis. They just don't have that coordination. The easiest one for people to use is a nebulizer, and that's where they put some solution into a machine and they breathe it in. We call it a peace pipe, basically.
Like a vaporizer.
Exactly. But the issue with that is that it's not very portable, so they're kind of tied down to the house or wherever they have that machine. So each has their own pros and cons.
But you can get out of the house and do things, even if you require either the inhaler or oxygen.
Yeah, just because you have COPD does not mean that you're confined to your house. Unless you're like very severe, you can go out and just enjoy a normal life. Now, you're not going to be able to do some of the things that other people do, like, run a marathon.
Exactly what I was thinking.
But, you can have a productive life that way.
And is it very prevalent in our area? Do you have a lot of patients come walking through the
Oh,
door
very
and
common.
say, they didn't even realize they had COPD?
Right. Usually the first sign of it is shortness of breath, that very subtle. Like, yeah, I noticed over the past year or two, I can't walk up a flight of steps without being short of breath. Or, after I'm walking around Walmart or, Target, I can't just wheel that cart anymore. Sometimes people present with a cough. I've been starting to have this cough and just getting more productive. And other ways, they may have some chest pain, but that's more rare. So.
But anything that's unusual that's been going on for some time,
Right.
several weeks, maybe, and like you said, sometimes
Yeah.
months, call your doctor.
Right. If you notice a change in your own body, something's wrong. So just get it checked out, because it may not be anything, but I'd rather have peace of mind knowing that, well, at least I had it checked out until it's too late.
Very, very good advice.
Yes.
Dr. Nathan Samsa, he is located at Union Internal Medicine Specialties in Dover. Thanks for being on Medical Minutes.
Thank you.
Thanks for watching.